This is Care of the Child in Diverse Settings, Part 2. So when we give discharge instructions, we're going to give follow-up appointments, and hopefully we've made those appointments and we're saying you're going to visit this doctor on this day and time and not just call them to make it themselves. We're going to give guidelines of when they should contact the provider. We don't want them to wait with the kid getting worse, saying, well, I don't go back until whatever day. So clear guidelines of when to call. Clear guidelines of dietary restrictions or recommendations. Give them this, don't give them that. And with that, time frames of when to switch. Activity levels, same thing. What restrictions do they have and what are the time frames on those restrictions? What medications are they on, including over-the-counter meds? And for us, we're used to giving lots of medications. 3-4 medications with different schedules can be very overwhelming to a family. So give them enough time to really go through those of when you give which ones. Treatments that they may need. Nebulizer or aerosol treatments for home. Do they need them at school? Dates the child can return to school or to daycare, and then referral information. Are we sending them on to a specialist? Who are they seeing? What does that specialist do? What's the child going to be seen for? So the role of the nurse in outpatient and ambulatory care. This is a child who comes in and has a procedure or surgery done and is sent home the same day. So there is a lot to do. They come in, we've got to do that admission assessment, any pre-op teaching and preparation. We want the child to know what they're going to have done, and we've just a short time there to make sure they're not overly anxious or frightened or imagining things that are far worse than what will really happen. We're going to do our assessment, support the family and the child again, figure out what they're anxious about and alleviate that. After the surgery, we've got post-operative monitoring. Case management. This means looking at the big picture. What do they need? Do we need to get special equipment for them? Do we need to get a specialist involved? Are they so anxious we need to get psych services or social services, somebody involved, and then making those referrals or collecting that equipment if they need a special car seat to get home, things like that. Teaching them how to use the things we are sending them home on. So a lot to do. It's nice that they don't have to stay at the hospital, but we need to make sure they really understand the teaching they get. So we send a lot of kids home on home health care, which is nice. The goal is to promoting, resting, and maintaining the health of the child. And it's nice you can do it without the stress of the hospital. Focus to minimize effects of the illness or disability and to provide family the means to care for the child at home. So the role of the nurse in family-centered care. We're assessing the needs as well as the knowledge deficits of the family, and what do they know, what don't they know, and teaching that. Make sure we're providing education at a developmentally appropriate level for both the child and the family. Some families you can give them a pamphlet and they'll read it and get it. Some are not going to be able to understand just from reading a pamphlet. So we've got to do that needs assessment as well as a developmental level assessment. We want to empower children and their families, so we want them to know how to do the care. We want them to have the supplies they need to do it, and then we're going to encourage them until they feel competent and capable of providing that child's care at home. So here's a child who's home with a trach. When you have a trach, you've got to have spare trachs in case it comes out. The family's got to be comfortable putting it back in because they don't have time to call somebody. If it comes out, they're the ones putting it back in. You've got to have suction in case it gets lodged. So a lot of things we've got to teach them. But look how cute she is. You want her home, not at the hospital. And sometimes we send home kids with very complex care at home. So there should be a home health nurse, home health agency who's available for them to contact with questions. Usually that person's bringing out supplies, checking, making sure the equipment's working right, but the family's doing the bulk of the care.